Well, let's bring you up to date now with the latest COVID data that we've just received in relation to COVID deaths. And we are seeing, I'm afraid to say, the highest number of daily deaths since the pandemic began, with a total of 1,325 deaths recorded in the last 24 hours. That's up from 1,162 yesterday and beats the previous record of 1,224 on the 21st of April last year. Daily cases are up as well, 60,053 reported in the last 24 hours, up from 52,618 yesterday. We've got a statement from Public Health England in relation to those shocking death numbers. Dr. William Welfare, Director for the COVID-19 response at PHE England, said each life lost to this virus is a tragedy, but sadly we can expect the death toll to continue to rise until we stop the spread. Approximately 1 in 3 people who have coronavirus have no symptoms and could be spreading it without realising it. He goes on to say, to protect our loved ones, it is essential we all stay safe at home where possible. This will reduce new infections and ease the pressure on the NHS and save lives. Well, let's get some analysis of those figures from Sky's Adele Robinson. And Adele, whether or not that is attributable to the new variant or the fact that people were mixing over the festive period, they are stark figures nonetheless.
They are. I think it was what we were all worried about, perhaps what we were all expecting as well. Though, as you say, we have now had the highest number of deaths, daily deaths, since the start of the pandemic. Just to reiterate what you've been saying there, within the last day, that 24 hours, there have been 1,325 deaths. That's deaths of people who've died within 28 days of a positive COVID-19 deaths. That's surpassed the highest number, which was on the 21st of April, which was 1,224. So surpassed it by a fair bit. Yesterday, we saw the second highest. That was 1,162. So the new updated daily figure for deaths is 1,325 within 28 days of a positive COVID-19 test. Also, the number of people testing positive as well, 68,053, which again, incredibly high, has jumped from yesterday. The reasons that it will have jumped from yesterday, that there's often a lag at this time of year because of bank holidays and the holiday period. So sometimes it's easy to get caught up in the daily decreases or increases when it comes to testing. It just depends on how that's been reported in the last couple of weeks and the last few days. But very high nonetheless. It's the 11th day that it's actually been above 50,000 cases. And I say not surprising because of the news elsewhere that we've heard today, such as London hospitals declaring a critical incident. And they join a number of other hospitals across the country, which are struggling to cope with the sheer number of patients being admitted. And as you say, there was this statement issued from the director for the COVID-19 response at Public Health England. Let me just repeat that. He says each life lost to this virus is a tragedy, but sadly we can expect the death toll to continue to rise until we stop the spread. Approximately 1 in 3 people who have coronavirus have no symptoms and could be spreading it without realising it. To protect our loved ones, it's essential we all stay home where possible. This will reduce new infections, ease the pressure on the NHS and save lives. So a stark warning there that we can expect the death toll to continue to rise above the highest it's ever been since the start of the pandemic. The other statistics released today, the R number, which on the face of it, it's compared with 2 weeks ago, has sort of stayed the same in that it's an average across the country, but the upper end of the estimate has risen. And the reason for the slight discrepancy on either end of this R number, it's now between 1 and 1.4. 2 weeks ago, it was between 1.1 and 1.3, is because there is this regional variation. There is a lag, though, in some of the data that is used to calculate the R number. Just to remind you, the R number basically the statistics today mean that on average, every 10 people infected, they'll go on to infect between 10 and 14 other people. But the data being used to come up with that figure, there is a lag quite often in terms of hospital admissions, is some of the data that they use, ICU admissions, deaths. And so it can be a couple of weeks before it's up to date. So the R number that we'll see in a couple of weeks' time might be more reflective of where we're at this particular moment in time. So it's important to remember that. But overall, the epidemic is increasing. Regionally, there are some differences. It looks like the Southwest is seeing an estimated between 1.1 and 1.5 R number, which is higher than the UK average. And also the growth rate, which looks at how quickly the number of infections are changing day by day. Across the UK, it's between 0 and 6%. But if you take the example of the Southwest, it's between 2 and 8% estimate. And in the Midlands, it's between 1 and 7%. Those two areas looking like they are worst affected in terms of the estimate for the growth rate at the moment anyway. But as I said, no surprise here, a tragic and grim almost milestone to have passed, that we have surpassed April's death toll today at 1,325 deaths within the last 24 hours.
Sad news. Adele, thank you very much indeed.